Before we dive into this shine a light conversation, I want to take a moment to introduce you to two incredible women, Kim Downey and Liza Nyeko. Kim brings a deep passion and a steady heart for physicians and the realities they face in today's healthcare system. She's a storyteller, a listener, and an advocate, someone committed to making space for physicians' voices to be heard. Liza's work sits at the intersection of healthcare, nonprofits, and human capacity for care. Liza spent 16 years working for academic medical centers before stepping back to look at healthcare from a broader systems perspective. Today, she works with organizations like the Patient Revolution and SOAR Management Consulting Group, which supports nonprofits in thriving. She's also recently launched Purple Zebra Coaching, where she works independently with healthcare and nonprofit professionals to strengthen both individual and organizational capacity. In this conversation, Kim and Liza share about a collaborative they've created to lift up physicians and other healing professionals. I'm grateful to them both for the work they're doing. I'm so glad the two of you are here. Let's step into this conversation. So, the first question I have for the two of you is, what inspired you to begin this work, or what need were you responding to?
I'm doing this work because I had cancer 3 times and my own doctor took his own life. So I was inspired to support doctors. And then I connected with Todd in Medicine Forward, which is how I connected with you. And then in the fall of 2024, we went to the Burnout Symposium in New York City and we did an open space event where we asked the question, how can we restore and nurture the human connection so needed in healthcare today? And one of the doctors raised his hand and he said, we have so much empathy for patients and we're expected to. How can we foster empathy in patients for us? And that ended up being one of the topic discussions, which really resonated with me. And then a couple weeks after that event, we did a joint event with HRC and Medicine Forward where we did a Zoom version. And that was one of the breakouts that people chose to enter. And I was the facilitator in that breakout room. And I believe it had the biggest attendance of the breakout sessions. And there were 2 of them. And we had such a great discussion. I was wondering if anyone wanted to continue it. So I was able to email the people who attended those breakout sessions, and they were interested. So we had a Zoom, and then I was like, what can we do? And Doctor's Day was coming up on March 30th. So I had an idea. I says, why don't we just try to make a big impact for Doctor's Day? So we, had like on social media, we were encouraging people to send thank you notes to their doctors. And we were saying, even if you are a doctor, that you have a doctor, or you can thank doctors. So I loved hearing one doctor said that he was sending messages to his residents on his team. And then I also ended up again, because these connections, connecting Dr. Aaron Hurley with Dawn Veselka, who has a Cards to Warriors program. And then Dawn ended up having one of her cards made for Doctor's Day. So it says, you've made a difference. And then anyone who wanted them could order them for free to send to their own healthcare professionals. And then she even took that further, and now they're available on carts in hospitals. So in the moment, a patient can write a note to a healthcare professional who's made a difference for them. And now, as we're regrouping, we are trying to figure out how we're going to take this moving forward.
That's awesome, Kim.
I think everyone who joined this really came to this topic from different angles, but shared a vision. And that vision, which we as a group spent several meetings actually trying to form and discuss, was to uplift healthcare professionals and foster their individual and collective flourishing. So I joined. For me, there was a growing awareness, a real kind of disconnect between the trust that we ask patients to place in healthcare and the actual capacity of systems and the people within the systems to fulfill that trust. There are tremendous strains. So when Kim asked who wants to continue this conversation after that breakout room, I was one of the first people to raise my hand. And it's been really wonderful to partner with Kim and to see all of the energy from her. That's really contagious.
We would
And
like to recognize Jennifer Sobon, right?
Yeah,
She's been
yeah.
a very active with us. So we would
nice,
like to
good.
recognize her.
How would you describe who you serve? What is your target audience that you're intending to be serving?
So we've had a lot of conversations about that. I think, clearly Kim's work is very much focused on physicians. There are some others in the group who do work a little more broadly, supporting healthcare professionals. And so when we talked about our mission and our vision, we kind of went with the term healthcare professionals because that kind of allows for the biggest umbrella, at least for now, and allows us to really cater to all of the interests that existed within the group.
What outcomes or changes have you seen that you're most proud of?
Well, I would like to start by sharing, our Doctor's Day initiative that we just said, let's do this, and we did it. And it really had a big impact. And then when I would share posts on LinkedIn, then people would share like who they were thanking, that they were thanking doctors. And then even like friends at church still come up to me and say, oh, because of you, I thanked my doctor. And I absolutely love hearing that.
When you can speak directly to those that you seek to serve, what do you most wish to say, or how do you most wish to impact them?
So for many years, I was noticing kind of independently the disconnects in healthcare delivery, but I wasn't fully aware of just how common those experiences or observations were, or how many people were working from different angles to, rethink and restore what healthcare could and should be. So I'd say to any healthcare professionals, if they aren't already aware, that they're not alone. There's a broad community thinking quite creatively and deeply about the challenges and what can be done to support those who provide care.
And if
That's
I was going to add a couple places I can spotlight to turn people to, is the Clinician Burnout Foundation is one, and there's resources there, so we can send people there. And then also the Dr. Lauren Bean Heroes Foundation, there's so much on their website. So if you look at the top, they have a tab that's called Take Action, and then there's highlighted for healthcare professionals, for pharmacists, and for physicians. And if you click on any one of those, then that brings you to specific resources. So if people wanted to check out Clinician Burnout Foundation, the Dr. Lauren Breen Heroes Foundation website, those are two that can really offer information and support.
excellent. First years, there's a lot to learn. So I'm curious, as you reflect back, I think just because of the nature of what I've heard you say, very fluid, you didn't hold yourself, I perceived constraints that might make you feel that you didn't achieve something. Instead, you were open to what could we achieve, which I love. But what's one lesson or insight you would want others working towards a similar goal? So not necessarily exactly what you're doing, but the bringing together others in a sense of collaboration. What would you like them to know?
So I feel like I could say it very simply in that you don't have to have it all figured out. You can just take what feels like the next right step.
Well, that was very succinct, Kim. Well done. All right. So, this next portion, what we love to do is the ask for what you need, offer what you can. What support, connections, resources, or other might you need to be able to move your work forward?
I would say what we need is support of others who share the same, mission and passion that can help us serve and move this forward. People have told me I'm starting a global movement, but what I've started to add is that one person is not a movement. Now, people would add to that that one person can start a movement, but that's why this has to be a team effort, and I need help.
So, what can you offer? How might you support or collaborate with others in the HRC network or beyond? You've already identified other organizations you're connected with.
Well, I would say I have many connections and I've spoken with many people. And when I talk to someone, I seem to know who they'd want to be connected with. So if anyone would like to reach out to me for a conversation, if we have a conversation, I would have a good sense of the direction that I can point you in.
Ideas, camaraderie, We welcome anyone. It's been really great to kind of meet new people and hear such inspirational ideas. And I think our challenge and opportunity is really to take those ideas and work together to figure out how to implement and scale.